1 in 10 Australians' private health records have been unwittingly exposed by the Department of Health in an embarrassing blunder that includes potentially exposing if someone is on HIV medication, whether mothers have had terminations, or if mentally unwell people are seeing psychologists. A report, published on Monday by Drive Chris Killy, Drive Benjamin Rubenstein and Drive Vanessa Teague from the University of Melbourne's School of Computing and Information Systems, outlines how to identify historical health data from the Australian Medicare Benefits Scheme, MBS, and the Pharmaceutical Benefits Scheme, PBS, released to the public in August 2016 can be re-identified using known information about the person to find their record. We found that patients can be re-identified, without decryption, through a process of linking the encrypted parts of the record with known information about the individual such as medical procedures and year of birth, Dr. Killy said. This shows the surprising ease with which de-identification can fail, highlighting the risky balance between data sharing and privacy. The study reveals unique patient records matching the online public information of 7 prominent Australians, including 3, former or current, MPs and an AFL footballer. While a unique match may not always be accurate, Drive Rubenstein said there was the possibility to improve confidence by cross-referencing other data. Because only 10% of Australians are included in the sample data, there can be a coincidental resemblance to someone who isn't included, he said. We can improve confidence by cross-referencing with a second dataset of population-wide billing frequencies. We can also examine uniqueness according to the characteristics of commercial datasets we know of, such as bank billing data. Privacy analyst and lockstep consultant Stephen Wilson said the breach damaged public confidence in health policy makers and data custodians. It's a huge breach of trust, he said. Promises of de-identification and anonymisation made by health officials, and ABS2 in connection with census data releases, have been shown to be erroneous. The ability to re-identify patients from this sort of public release is frankly, in my view, catastrophic. Real dangers are posed to patients with socially difficult conditions. It beggars belief that any official would promise anonymity anymore. These promises cannot be kept. Computer security researcher Troy Hunt said re-identification of anonymized records was attractive to researchers and nefarious parties alike. In this case, clearly more work needs to be done to protect individuals' identities, he said. My hope is that the government embraces responsible research like this and strives to improve confidentiality rather than penalize those seeking to report deficiencies such as this. The Federal Department of Health was notified about the issue December last year. The Department of Health takes this matter very seriously and had already referred this to the Privacy Commissioner, a Department of Health spokesperson told Fairfax Media. The project was halted and remains halted, and the dataset was removed immediately.